There's been tremendous work that's been done, obviously, around protecting our patients and the transmission of the virus, the characteristics of the virus. We know that it is particularly devastating for older individuals, although younger folks can get very sick from the virus as well. The good news is now, compared to in the very earliest stages of the pandemic, we do have treatments that have come forward. Monoclonal antibodies are a tremendous boon to those patients who are at risk for severe infection and only have a mild infection. It's been very effective at preventing those patients from having to be hospitalized. We also have an antiviral treatment, remdesivir, which is being used, dexamethasone, which is an anti-inflammatory, which has been around for a long time, but is proving to have benefits to treatment in patients in the hospital with COVID. So we are finding better ways to treat patients who do come down with COVID, and we also know that how important it is to wear masks, to wash hands, to physically distance from others. And of course, the vaccine has just been a real scientific breakthrough in how quickly that was developed. We don't know the longer-term immunity. We don't know if the vaccine will confer lifelong immunity for 1 year, somewhere in between. We just don't know that yet because we don't have the experience. Similarly, for patients who have been infected with COVID, we don't know how long the immunity will last there. There are also a lot of questions about long-term effects of COVID. I think we've all heard about so-called long haulers, or people who have had an infection with COVID and have symptoms that just linger and continue on. So there's still an awful lot to be learned about the virus. Additionally, as we've all heard in the news lately, there are mutations, and that's what viruses do. Now, the mutations out of the UK and South Africa seem to demonstrate a higher capacity for transmission, but not necessarily for severity of disease. So we're keeping a close eye on that, but there's still a lot to be learned about the virus.